that you've heard about today. So this is transforming healthcare through multiomics, AI, and big data. Woo! Okay, seriously though, this is actually a really, really incredible, innovative way for us to bring together a whole lot of cutting-edge technologies into meaningful and insightful pipelines that allow us to do good things that are tangibly changing the world. We're making a real difference to help people, and that's why we're all here. So traditional medicine, as I'm sure you're all aware, is really effective and it's made a big difference in the world. It's saved many lives, it's changed quality of lives. However, even with traditional medicine, we have cases where there's non-targeted treatments that mean that with some people we have low efficacy or no efficacy in the treatments. Precision medicine is the way of the future for healthcare. We're able to leverage insights about not only biomarkers and genetic analysis, but the lifestyles that people lead, and use that to create targeted treatment that means that nobody needs to fall through the cracks anymore. Leave no one behind is the goal. So, enter precision medicine. We have PrecisionGO, which is here at WIMA, we are building, in fact we're not building, we have a comprehensive, advanced, end-to-end precision medicine pipeline that is going to, and already is, accelerating the national implementation of precision medicine at the clinical interface. We're doing this by bringing together novel omics projects, and that consolidates all of the capabilities that we have at WIMA and the Westmead Research Hub, as well as filling in 6 amazing new technologies that allow us to build this end-to-end pipeline, along with the expertise of the incredible professionals that you've heard from today so far. We're also running training and education programs that mean that we're upskilling and building workforce capacity so that the doctors and clinicians and researchers of the future have the skills to really push precision medicine forward. And all of this again means that we're able to make a difference for patients. So the 6 new technologies that I mentioned before fill in with the over 100 incredible technologies that we have here in these 4 particular areas. So there's the high-speed full spectral imaging cell sorting and analysis. There's the advanced single-cell spatial transcriptomics. We've got high-throughput single-cell partitioning and high-throughput digital PCR. You've heard about the incredible specialists and the incredible technologies so far. What these actually come together to enable is discovery and screening pipelines. So these pipelines allow us to discover biomarkers of disease, and that allows us to run new clinical trials, come up with new diagnostic treatments, and overall better patient health outcomes. This is not a short-term process, it is not a cheap process, but it is the way of the future, and it is what allows us to make a difference, to leave no one behind. And all of the technologies that you've heard today are part of bringing all of this together to allow us to achieve this outcome, this goal. So you've heard Joey speak about these, but we've got the single cells multi-omic pipeline, high resolution spatial whole transcriptomics pipeline, and the single cell spatial transcriptomics pipeline. So these are all really exciting. These are ready to go. If you are interested, no matter where you are in Australia, you can reach out to us and approach us for a customized quote, and we can support your work to push it further with better analytics, better insights, help from Brian, bioinformatics. What we're also going to do is we're in the process of developing the PrecisionGO digital platform as well, which allows us to push all of this even further, because we're then bringing in a big data system that allows us to, in an ethical way, in a cyber safe way, to be able to bring together all of the large quantities of data that is generated through all of these pipelines, along with connecting them to patient databases, etc., again, in a way that is secure, to allow us to really scale up the ability of the insights that we're able to generate from the work that we're doing. I'd like to also bring your attention that in 2027 we will, as part of PrecisionGO, be conducting 2 proof of principle trials that allow us to put into practice all of this work. So if that is something that you might be interested in being part of in 2027, reach out to us now and start having those conversations, because we'd love to make this a truly symbiotic, reciprocal, beneficial way forward that allows us to help you and you to really gain something from this as well. And again, the reason that we're all doing this, the reason that we care about this, the what if for the future, is that when we have early disease detection and targeted therapies, we really have the roadmap to improve patient outcomes. When we have the right training and education programs around precision medicine, we are building a skilled workforce in genomics and data science, the way of the future. And when we have an open access model, we are facilitating the pathway forward for global collaboration for better health equity, which is something that we need in the way forward for the world. Thank you.